You wake up at 3 in the morning clutching your chest. Your heart pounds against your ribs like a prisoner against iron bars. You drive yourself to the emergency room because you cannot afford the ambulance. They save your life. Then they hand you a bill for $82,000. That number just erased 20 years of work. That number just cancelled your future. That moment, right there, is when the trap closes around your throat. This is not a new invention. This system has Roman fingerprints all over it. In 451 BC, the 12 tables of Roman law codified something that would echo through millennia. If you could not pay your debts, you became property. 30 days after default, your creditor could imprison you. Your body became collateral. Your labor became rent for your own existence. If multiple creditors owned pieces of you, Roman law permitted them to literally dissect your body and divide it among themselves. They could carve you up like currency. This was not metaphor. This was policy. But here is where it gets darker. A creditor savagely beat the son of a debtor after the son refused sexual advances. The public outcry forced the Roman Senate to abolish debt imprisonment in 326 BC. Even Rome, built on conquest and slavery, recognized this trap had become too barbaric to sustain. Yet 23 centuries later, America has rebuilt the exact same machine with better branding. Stage 1 arrives with the promise of protection. You purchase health insurance. You pay premiums every single month. The insurance company whispers the same lie empires have always told. We will keep you safe. We will catch you when you fall. You believe them because the alternative is unthinkable. 29 million Americans have no insurance at all, but 90% of the country does. And yet, 41% of insured adults still drown in medical debt. The insurance is not armor. It is a trapdoor painted to look like a floor. Stage 2 is the medical emergency itself. 2/3 of medical debt comes from a single unexpected event. You do not plan to get cancer. You do not budget for the car accident. You do not anticipate the stroke that turns your brain into a broken telephone. These crises arrive without warning and without mercy. The average medical bankruptcy filer owes $17,000 in uncovered expenses. But some owe $50,000. Some owe $500,000. The number does not matter. What matters is that you cannot pay it. Not today, not ever. Stage 3 is the moment you discover what your insurance actually covers. You thought 80% sounded generous, but 20% of a $250,000 cancer treatment is $50,000. 20% of an emergency surgery is $12,000. Deductibles reach $6,000 before insurance pays a single cent. Copayments stack like bricks. Out-of-network providers bill you separately even though you had no choice which surgeon operated while you were unconscious on the table. The median hospital stay costs $15,000. Insurance covers most of it, but most is not all, and that gap is where you fall through. This brings us to stage 4. The billing starts. The hospital sends you the first invoice. It arrives in a plain white envelope with numbers that make your vision blur. You call to negotiate. They transfer you 6 times. You ask about charity care. They tell you the application is 40 pages long and requires 3 months of pay stubs, 2 years of tax returns, proof of every asset you own, and documentation of every medical expense you have already paid. You work 50 hours a week. You have 3 children. You do not have 40 hours to complete their paperwork labyrinth. This is not accidental. This is architecture. Hospitals train their billing staff to ask for payment multiple times before even mentioning financial assistance. A consulting firm in Washington State taught hospital employees to tell every patient, no matter how poor, that payment is expected. Not that help is available, that payment is expected. The math here is surgical. Non-profit hospitals receive billions in tax exemptions specifically to provide charity care. In exchange for not paying taxes, they promise to help the poor. But in 2017, non-profit hospitals spent only $14 billion on financial assistance. That sounds generous until you realize these same hospitals generated over $800 billion in revenue that year. They spend less than 2% of their income helping the people their tax exemption was designed to protect. The IRS requires them to have financial assistance policies. It does not require them to make those policies easy to access. And so the poor drown in paperwork while the collection notices pile up. Stage 5 is when the debt collectors arrive. You missed one payment because your credit card number changed and the automatic payment failed. The bill goes to collections before you even know you are behind. A woman in Illinois was arrested and jailed for a $730 unpaid medical bill. She was being treated for breast cancer. The hospital told her to ignore the bill. They lied. The collection agency filed a lawsuit. She never received a notice. She missed her court date. They issued a warrant. Police handcuffed her and took her to jail for the crime of being sick and poor. This is not a conspiracy. This is the business model. Medical debt is now the number one source of debt in collections. It has surpassed credit cards. It has surpassed auto loans. It has surpassed utilities. More than half of all debt collection actions in America are now medical. 58% of everything a debt collector touches is healthcare. That means when you hear a knock on your door at 7 in the morning, when you see the unknown number calling your phone 12 times a day, when you open your mailbox and see the red envelope more often than not, it is because you got sick. Stage 6 arrives when the debt begins erasing your future. 14 million Americans owe more than $1,000 in medical debt. 3 million owe more than $10,000. The debt sits on your credit report like a scar. Your credit score drops, you cannot get a car loan, you cannot get a mortgage, you cannot get approved for the apartment you need because your credit is destroyed. You cannot expand your small business because no bank will lend to you. You had a stellar credit rating before the fire that burned 66% of your skin. Now you are buried under $82,000 in bills, even after insurance paid most of it. The medical debt on your report means you cannot borrow money at reasonable rates to restock your business. The trap does not just take your money, it takes your mobility. But here is where the system turns deadly. People with medical debt avoid further medical treatment. 63% of adults with medical debt skip necessary care because they cannot afford more bills. Compare that to 19% of people without debt. The debt makes you sicker. The sickness creates more debt. This is not a spiral, and this is a meat grinder. You are being processed. Stage 7 is bankruptcy. 666,000 Americans file for bankruptcy every year because of medical bills. That is one person every 47 seconds. That is 17 school buses full of people every single day. 66% of all bankruptcies are caused directly by medical expenses. Not reckless spending, not gambling, not living beyond their means, getting sick, having a child, breaking a leg, surviving cancer. These are the crimes that destroy families. And these are not the very poor. 2/3 of medical bankruptcy filers are homeowners. 60% are college graduates. These are middle-class Americans who did everything right. They went to school. They bought insurance. They worked full-time jobs. They saved money. Then one medical crisis deleted everything they built. 90% of them took out second mortgages on their homes to pay medical debt. They turned unsecured debt into secured debt. They bet their house on their health, and they lost. The average medical bankruptcy filer is 45 years old, with a household income of $2,600 a month. Think about that. These are not wealthy people, but they are not destitute either. They are the working class. They are nurses and teachers and construction workers and small business owners. They are one emergency away from financial execution, and 20% of them are military families. People who served their country come home and get bankrupted by the healthcare system they defended. Here is the part they do not teach you in school. This system was designed to function exactly this way. Debtors' prisons were officially abolished in America in 1833. The last one closed in Virginia in 1849. But debt imprisonment never disappeared. It just changed costumes. In 1970, the Supreme Court ruled you cannot extend a prison sentence because someone is too poor to pay fines. In 1983, the court affirmed that jailing indigent debtors violates the 14th Amendment. Yet today, a quarter of the jail population in Benton County, Washington, is there because they owe fines and fees. People sit in cages because they cannot afford court costs. The debt is criminal justice debt now. It is child support debt now. It is medical debt now. But it is still a cage, and the cage still only holds the poor. This is where the modern system reveals its ancient DNA. In medieval Europe, Debtors' prisons held you until your family paid your debt, or you worked it off through penal labour. In England, in 1641, 10,000 people were imprisoned for debt. Over half of London's prisoners in the 1700s were debtors. Charles Dickens's own father was thrown into the Marshalsea debtors' prison for owing £40. Entire families lived inside these prisons. Children grew up behind bars because their parents could not pay. When the Fleet prison closed in 1842, they found 2 debtors who had been there for 30 years. 30 years in a cage for being poor. The Marshalsea functioned as an extortion racket. If you could afford prison fees, you got access to a bar and a shop, and the crucial privilege of being allowed outside during the day so you could earn money for your creditors. If you could not pay the fees, you were crammed into one of 9 small rooms with dozens of others. Your debt increased every day because prison fees accumulated. You could not work to pay your debt because you were locked inside. You could not leave until your debt was paid. The trap was perfect. It was designed to be inescapable. That design is still operational today. Look at the math again. Americans owe at least $220 billion in medical debt. Some estimates say $140 billion. Some say higher. The exact number does not matter because no human brain can comprehend these figures. What matters is that 31 million Americans borrowed $74 billion in 1 year just to pay for healthcare. 12% of American adults had to borrow money to avoid dying. 58% of Americans are afraid that a major health event will bankrupt them. This is not anxiety, this is pattern recognition. These people have watched their neighbors disappear into debt. They have watched their parents lose their homes. They know the trap is real because they have seen it close. The system operates through what it calls financial assistance. But assistance requires you to prove you deserve it. You must demonstrate your poverty with documentation. You must confess your desperation in writing. You must beg for mercy from a hospital that already received billions in tax breaks specifically to provide this help. The hospital defines medically necessary care however it wants. They can exclude kidney stone removal. They can exclude cancer biopsies. They can exclude cardiac valve replacements. Care that is needed but not urgently required does not qualify. So you wait. Your kidney stones become an infection. Your suspicious lump becomes stage 4 cancer. Your faulty heart valve becomes cardiac arrest. By the time your care becomes urgent enough to qualify for assistance, you are sicker. And sicker means more expensive. The delay is profitable. Even if you qualify for assistance, the physicians are not employees. They are independent contractors. They bill separately. Your anesthesiologist, your radiologist, your emergency room doctor, your pathologist. None of them are bound by the hospital's financial assistance policy. You can get the facility charges waived and still owe $30,000 to doctors whose names you never learned while you were unconscious. This is not a loophole. This is a design feature.